Calculate your pregnancy due date. When you start announcing your pregnancy, everyone will start asking what your due date is. While this date can help you plan your life around your birth, there is no precise way to tell for sure what day your baby will be born. Every pregnancy's due date carries a plus or minus 2 weeks. In fact, less than 4% of women actually deliver on their due dates. Over 12% of babies are born prematurely or before 37 weeks. Some pregnancies actually last longer than 42 weeks, though this is becoming increasingly rare. The average length of pregnancy is 280 days or 40 weeks, and there are some factors that can contribute to your due date. These factors include ethnicity, prenatal care, prior pregnancies, prenatal nutrition, and mother's age. Nagels Rule. The Nagels Rule is the one your care provider will use to determine your due date. For this method to work, it is assumed you have a 28-day cycle and you ovulated on day 14 of your cycle. For the Nagels Rule, you take the first day of your last period, and subtract 3 months. Then you add 1 year and 7 days to the date. This date will equal your due date according to the Nagels Rule. This method works well, but only if your cycle is 28 days. Many women do not have 28-day cycles, or they have irregular cycles. Middendorf-Williams Rule. In a study done by Middendorf in 1990, it was discovered that on average, it takes 288 days from the first day of your last period to delivery in Caucasian women without prior deliveries. Using this method, you will want to take the first day of your last period and subtract 3 months. Then you add 15 days if this is your first baby and you are Caucasian. If you are not Caucasian or this is not your first baby, you will want to add on 10 days. Some studies have found the Middendorf-Williams Rule to be more accurate than Nagels Rule in calculating due date. Websites. Many baby websites offer due date calculators that can help you calculate your due date. For the majority of them, you will need to know the date of your last menstrual period and may need to know the average length of your cycle. Your care provider will also let you know what your due date is. Ultrasounds. Ultrasounds can give you a general idea for your due date. Your ultrasound technician will measure the baby's body parts, like head circumference and length of bones. Using these, the technician will be able to estimate your baby's gestational age, and thus your due date. Required tools. knowing the first day of your last period, a calculator, a calendar, average length of your menstrual cycle. Quick tips: remember that this is just a guess estimate date. No one actually knows when you will deliver. Useful links: Baby Center, Amazing Pregnancy, March of Dimes.